Another potential way to control global population growth would be to advocate for or incentivize having fewer children without enforcing a specific number of children people are allowed to have. In looking at the effects of such a policy when enacted in the real world, it is useful to look at family planning programs in China preceding the one-child policy, as well as the differences between Shanghai and the rest of the country during this period. Due to programs and laws that encouraged but did not require having fewer children, the birth rate in Shanghai was only 2.4 in 1964 compared to almost 7 nationally. Contributing to this were birth planning committees that provided access to birth control and encouraged families to have fewer children, and laws that instituted a minimum marriage age of 25 for men and 23 for women. By the time the one-child policy was drafted, the birth rate in Shanghai had dropped even farther to between 1.03 and 1.3. Nationally, the birth rate had been brought down to 2.8 by the end of the 1970s by a campaign that from 1973 to 1979 advocated later marriage, more time between births, fewer births per couple, and increased access to birth control. Based on the success that this approach had and the lack of social consequences, it has the potential to be more viable as a global policy than laws limiting the number of children people are allowed to have. However, it is also not a perfect solution. There are many countries that are actually currently doing the opposite, providing incentives for people to have more children. Although the global population is increasing, in several countries, for example Germany, Japan, Russia, and Taiwan, not enough children are being born to maintain a steady population. Although there are short-term benefits while the working population has fewer children to take care of, the lower birth rate becomes a problem when the population begins to age and there are fewer workers to pay for pensions and to keep the economy running. Countries in this category would likely be unwilling to accept international legislation that incentivized having fewer children. And while the obvious solution is to only institute these programs in some countries, it turns out not to be that simple. Pushing people in some countries to have fewer children, while other countries are still allowed to be working to increase their birth rates, is problematic at the very least, especially considering the countries that would likely fall into each group. This would not only just be unfair, but have the potential to be misused and cause significant backlash or flat-out refusal to comply with attempts to control population growth. The countries that we consider developed, often for a variety of reasons, have much lower birth rates than what we call developing countries. A third strategy to try and control global population growth would be to try and spread some of the things that lead to a lower birth rate in developed countries to countries that have higher birth rates. These factors, for example, female education, reduced infant mortality, a stable economy, and some sort of social safety net would also have other benefits. There are, of course, problems inherent in trying to quote-unquote develop countries. In doing this, we risk imposing a single definition of what is developed and civilized on many countries regardless of their wants, needs, or interests, and of falling into the mindset of seeing the developing countries as backward or inherently inferior. It is also challenging to find the balance between implementing these changes and maintaining the culture and values pre-existent in a society. One of the most significant contributors to a lower birth rate is female education. Even a 1-year increase in primary schooling for women and girls in poorer countries is shown to have reduced the number of children born by 0.614. Women having access to higher education also contributes to a lower birth rate. Women who receive higher education often go on to join the workforce and have less time and less of a desire to have and take care of children. For example, even in Germany, where generous paid maternity leave makes it possible for working women to have children, the country is still anxious about its decreasing birth rate, as many women would simply prefer to work. Infant mortality also plays a role in the birth rate of an area. A 1-point increase in infant mortality corresponds to an increase of 0.012 in birth rates. In areas with higher infant mortality, families will often have many children in the hopes that even just a few will survive to adulthood and be able to support the parents as they age. Lower infant mortality rates would also lead to longer intervals between births, and therefore fewer births overall due to prolonged lactation since the baby survives, and the parents being focused on the continued care of that child since they are more certain that it will live and be worth the investment. Another crucial factor in lowering birth rates is developing a stable economy and programs to provide some sort of social safety net. Developing countries in particular tend to see population growth as a way to ensure economic growth and success, and therefore encourage people to have more children. In countries that already have some level of economic stability, this pressure is less, although as shown by the countries that are currently trying to increase their birth rates, not entirely gone. An ideal solution would be to alter the economic structure of the world in such a way that economies would not be dependent on a large population for success, But perhaps more realistic would be to work towards developing the country's economies to a point where the pressure to continue increasing the population is somewhat alleviated. Also important would be to provide a social and economic safety net for families in need in countries with a high birth rate. In places where families rely on the economic or labor contributions of every member, parents are likely to have more children so that there are more people who are working and helping bring in income. Social programs to provide aid to these families could eliminate the need to have the children work and lead to lower birth rates, as well as higher levels of education that would further reduce the birth rate. Another factor that seems fairly obvious but also should not be ignored is access to contraceptives. In countries where birth control is widely available and socially acceptable to use, the birth rate is often much lower as a result of couples being able to decide whether or not to have children and how many children they want. As for many large problems, there is no easy solution to global population growth. Many of the potential options boil down to either people being forced to have fewer children, or the countries that we consider quote-unquote developed working to reduce the birth rate in other countries that may or may not welcome these interventions. What could work best for now might be a system in which countries could agree to initiate and would receive funding for programs aimed at increasing female education, reducing infant mortality, and providing birth control options. But it is unlikely that this alone would be enough. More research done by experts in the field will be needed to determine and implement a viable and permanent solution.